For Session Update, I'm Shannon Lurkey. At the state capitol, Governor Mark Dayton and DFL lawmakers urged Republicans to pass a public option for the MinnesotaCare program as a way to make health insurance both more accessible and more affordable. Later, state health officials provided an update on the progress of the backlog at the Office of Health Facilities Complaints. Here's that press conference.
All over the state of Minnesota, people are finding that their health care insurance is unaffordable. 116,000 Minnesotans dropped their health coverage last year compared to the year before. And I think most of that was because of the costs of their coverage and also the poor quality of the coverage that they would receive. One farmer yesterday, I met with Farmers Union group, and one farmer said he and his wife were paying $38,000 a year for their health insurance. I mean, that's just prohibitive. Last fall, then Lieutenant Governor, now Senator Tina Smith, Commissioner Emily Piper, Representative Clark Johnson, and Senator Tony Laurie were here today, held town hall meetings to discuss this MinnesotaCare buy-in proposal. And the Farmers Union under President Gary Werdish was also here, held similar meetings to make people aware this is a possibility. What we need now is for the legislature to take the necessary action. This proposal would allow anyone to purchase MinnesotaCare coverage through MNsure, which also would mean that qualified Minnesotans who purchase this coverage would be eligible for federal tax credits through MNsure to further reduce the cost of their health insurance coverage. Coverage would begin January 1st, 2020. Last year's proposal, which Senator Laurie and Representative Johnson championed, projected that MinnesotaCare buy-in would have cost an average $469 per person per month. For their 2018 coverage, that would be almost 13% less than the average projected premiums for commercial health plans in the prior year, and that information will be updated shortly. The principal reason for that is because the insurers require a 20% margin for their overhead. So 20 cents out of every health care insurance dollar that people are paying is not going for the health care. It's going for the overhead administration of by the insurers. People say that we shouldn't have government competing with the private sector. Well, the private competition is good for everybody. It's good for retailers. I learned from my family. It's good for just about everything. It may not be what the providers like, because nobody wants a new competition. But it gives the consumers choice, and it almost always improves the quality of the choices that they have. The private sector doesn't mind competing in the state auditor's office with private CPA firms with the state auditor to provide that coverage. So the reverse should be equally true. The competition is good for everybody, and it'll lower costs for consumers. It'll improve the quality of the coverage that is available throughout the state. And if people are concerned about the affordability of their health care, this is the single most significant step that Minnesota could take to make that health coverage more affordable and of better quality. And I strongly urge the legislature to enact it in this session. So I'd like to turn it over to Senator Tony Laurie.
Well, thank you, Governor, and thank you for coming today. And I'll keep my remarks brief. I think it's important we start to hear from some of the stories. I know Gary Werdish with the Farmers Union is here. As the Governor mentioned, I did join now Senator, former Lieutenant Governor Tina Smith, and the Commissioner Emily Piper on some town hall hearings all around the state, and really tried to kick the tires and see what people thought about this MinnesotaCare buy-in option. And it was incredibly well received by every city that we visited. We had conversations with the press in the cities that we visited. Some of the things that are really important to understand about MinnesotaCare and this buy-in proposal is that MinnesotaCare is a trusted source of health insurance for people all across this state. And that's kind of rare right now. A big part of the degradation in the insurance landscape, the increase of uninsured in our state, has to do with people not thinking that the options are working for them. 75% of the uninsured are eligible for MinnesotaCare, medical assistance, or advanced premium tax credits to help them purchase insurance. And MinnesotaCare is that trusted option that will bring people forward and actually re-engage them in our insurance landscape and will provide that competition for the individual market that really isn't providing the options, particularly in Greater Minnesota. Greater Minnesota is incredibly challenged with networks that are too narrow, that don't allow people to see their doctors. And I know the Farmers Union will tell some stories about this as well. A really important aspect, it's that trusted source for over 25 years that has a better network and really competitive prices to make sure that every single Minnesotan has access to quality and affordable health care. And I'm proud to stand with the governor and with Representative Johnson, who's I think going to speak next, and revamp this MinnesotaCare buy-in for the 2018 session. Last year, we did have in the Senate some bipartisan support as we went, and I will be looking for that again. I will be working very hard to be open to ideas from across the aisle and try to bring my friends and colleagues that have a little different view of things sometimes forward and try to really engage about what it is that we need to do to make sure, again, that every Minnesotan has access to quality and affordable health care. That's going to be the test that we're going to be put to. And right now, as we've seen the uninsured incidence rate climb, it's clear that we're not there yet, and we need some additional options on the table. I think that MinnesotaCare buy-in should get serious consideration in this session. And I need to run because the Senate Finance Committee is actually looking at the forecast from a Health and Human Services lens, and I need to make sure that we get some of the questions right. But most of you press know how to find me. Happy to answer questions as we work through the session, and look forward to really engaging in this important discussion. Thank you.
I'm Representative Clark Johnson. I live in North Mankato. I represent all of Nicollet County, part of Mankato, and Kasota and Leesore County. And I hear from my neighbors consistently that they're discouraged, they're disappointed with the private health insurance market, and they say we need something better. And when I chat with them about the MinnesotaCare buy-in proposal, they go, yeah, why don't you do that? And when I respond, unfortunately, this is not had a hearing in the House, they go, well, it seems like we should at least figure this out. And so I'm here today to call upon the Republican leadership in the House of Representatives to hold some hearings. Let's figure this out. Let's do this. I attended hearings, the town halls in Worthington, Wilmer, and St. Cloud. We consistently heard what I'm hearing at home, that Minnesotans want another choice, that they see MinnesotaCare as an excellent choice for their family. And fundamentally what we're proposing is that when Minnesotans go on the market in a couple of years, that they will see an option of, among the options, to buy into the MinnesotaCare. Some families will say, well, that's not working for me. They'll choose something else. But I think many Minnesotans will say, that will meet the needs of my family. I am particularly discouraged and sad about the decrease in numbers of families that have health care and have chosen to move away from actually purchasing health insurance. I've met those people at their home, and those are scary conversations for them and for me as someone who really sees we've got to deliver on this. It's two fundamental aspects in their families. First is their health care. Fundamentally, this is about health. This is about the health of a family. And when you don't have health insurance, your health is at risk. A family's health is at risk. But it's also a fundamental issue of their economic health of that family. We've got to do better. The MinnesotaCare buy-in, I feel strongly, is a way to do that. And again, I call on the Republican leadership to hold hearings and let's get moving on this. Thank you.
Morning. Gary Werdish. I'm president of Minnesota Farmers Union, and I farm out in Renville County along with my son. And I go back to, this is approximately 25 years that the MinnesotaCare program has been in existence under a bipartisan bill under, at that time, Governor Carlson. I remember one of my neighbor families were young dairy farmers at that time and raising a young family. And after this got passed, they said, now we can have health care. We can provide health care for our family. Going forward now, last year we held Minnesota Farmers Union, we held 14 rural voices discussions around the state. The two issues we heard the most was the low profits on the farm. Due to the low commodity prices, farmers are struggling just to try and pay their bills, get their operating loans, and pay them back, plus try and put some food on the table. The other issue we heard the most was the high cost of health care. We had one farmer that was down in the Rochester area testified that he said that with his high deductible and his insurance premium, he was paying $43,000 a year for health care costs. He said as he was meeting with his banker to get an operating loan for the upcoming year, the banker told him, he said, well, you got to cut costs. You got to look through. And he said he looked through all his records and his balance sheet and everything. He said the only thing he could cut that wouldn't affect his income was health care. So he said, do him and his wife take the risk of not having health care? And that's what's happening out there. People are dropping health care, taking that gamble. As farming is one of the most deadly professions, or dangerous professions, I guess is a better way. But, we can be very healthy. You can go out and get into a farm accident. It can happen very easily. You can get into a car accident, or you can get a sickness. You can get a major sickness. And then you're really putting your whole your economic future at risk. Governor Dayton mentioned that we were in here the same room a couple days ago at our Minnesota Farmers Union Lobby Day. We had one of our farmer members that spoke that him and his wife were paying that $38,000 a year for health care costs. He said he's worked all his life as a farmer, building up equity. And now as he's looking in a few years down the road, hopefully being able to retire, but he says we're burning up our equity. The way this is going, we aren't going to have any equity left, and that's unfortunate. It's an issue. We strongly support the MinnesotaCare buy option. It is another option. Right now, there aren't options on the table. But this looks to be an option that would work well for farmers, and we strongly support it. Thank you.
I just say that the dividing line is very clear here for legislators. Do you side with the insurance companies, or do you side with the people of Minnesota? It's that clear cut, and we'll see how it proceeds accordingly. Answer questions on this subject?
You mentioned that the Lieutenant Governor and Senator was all over the state holding town halls on this. Did you feel like you got any traction from that? Is there more support now for that effort or not?
I think there's a lot of traction, those who are aware of it, and President Werdish could speak even better. He held 14 farm forums, and legislators and others who are traveling around tell me that this is really the #1 concern that people have, because you talk about tax cuts and other ways in which people end up with more money in their pockets, but here you have a situation where people are their basic cost of living is being ratcheted up and becoming unaffordable. I think President Werdish said it very well. They take a gamble, a serious gamble, that they're not going to need that coverage when it happens.
Some of the resistance to this in the past has been because MinnesotaCare's reimbursement rates for providers are considered low compared with other kinds of insurance. Is there any move afoot to address that part of the problem?
Well, we'll look at the reimbursement for the providers. I think that's a valid question, and that's something that the legislation could fine tune. But bottom line is, they have virtual monopolies. We have very, very limited coverage, as the two legislators said, in greater Minnesota. It's not good coverage. And as I say, one of the reasons is they need at least 20% of the total premiums costs that are paid for their own administrative overhead. They're nominally nonprofit, but I mean, it's all goes into the same, which, MinnesotaCare doesn't have that percentage, and so it's a lot more efficient delivery of service, and it's a lot better, therefore a lot better option for a lot of consumers. And it also means the insurance companies have to put their pencil to paper and look and see how they can make their offerings more competitive, both in terms of quality and cost.
Governor, if this goes on the MinSure exchange and private providers, insurers decide, we don't want to compete with the state of Minnesota, does that have an unintended consequence of weakening the MinSure exchange? that you have?
We have that problem already. I mean, we have providers deciding that they don't want to sign up for the next year, or I'm sorry, insurance companies. And then we're left scrambling to find somebody, anybody, and the like. So, I mean, they're already, a number of them have already pulled out. And, they'll stay in if it's profitable on their terms. But they'll have to be more competitive. And, I mean, you can say that about any time you're taking a monopoly position and introducing competition. Somebody's going to decide that they don't want to compete. But that's not the purpose of this. The purpose is not to drive the private insurers out of the market. The purpose is to provide better quality, more affordable health care to Minnesotans and their families.
Has anything changed politically in the last year to show you there could be different outcomes?
It's going to be an election. As I said, the dividing line on this is very clear. You either side with the insurance companies who are going to oppose this fiercely in the legislature, or you side with the people of Minnesota who need and want this better cost, better quality health coverage.
With the federal government having withheld some basic health care funding, and with the provider tax in Minnesota due to sunset, is MinnesotaCare a stable product?
Well, it is certainly as long as the provider tax exists. I mean, and this will be next year after I'm gone, but when the legislature and the new administration have to face the reality that on December 31st, 2019, the provider tax disappears. I mean, all of MinnesotaCare is suddenly in serious jeopardy, and it's just a matter of the clock running out on the resources that have been stored up. But yeah, I mean, it's only as stable as a funding source or a viable alternative, and that's something that next year's leaders will have to deal with.
How do the premiums that would be charged for MinnesotaCare compare to the programs offered by the co-ops, two programs out there now?
Well, I said last year that when they did the analysis, it was 13% less.
The co-ops?
Oh, the co-ops.
Co-ops, the Land Lakes and what's it?
I don't know, you know?
Gary, can you help us?
If you call it, the way the co-ops work right now, it's a competitive product. If you qualify for a subsidy, you're still better off going into the MinShare program. But how they compare with the MinnesotaCare buy-in, I'm not completely sure. But they do offer a competitive product throughout the state.
Do you have quite a few of your members getting that?
Yeah, we do. Minnesota Farmers Union, we got involved in that mainly because it's another option. There aren't enough options out there, and we felt this was a good option to put forward. And thank the legislature for allowing ag co-ops to be able to do it.
Would MinnesotaCare endanger the co-op's existence, the insurance program?
No, I don't believe so. There's a need for health care. I mean, the two could work very well together. And if MinnesotaCare is, if it's administered right, or it is administered, but if it's provided to the people to buy in, it would take off too.
Go ahead, last one. Yeah.
The individual mandate is gone in 10 months, and there are very credible estimates that that's going to drive up individual market rates by at least 20%. Are you looking at, or what else should Minnesota be doing to get ready for next year when, by most estimates, the number of people, you're going to have sicker people buying health insurance in that pool, and healthier people are going to be on the sidelines doing other things to cover themselves. What else should Minnesota be doing to try to address this, I mean, arguably collapsing individual market?
Well, I think that's the intent of the Trump administration. I mean, they run on the ideology of against the Affordable Care Act, but of course they have come up with no alternative other than they throw everything back to what it was before. You're on your own. You can either afford private insurance or without any subsidy or assistance, or you're without, and we'll have a rising uninsured rate, and more and more providers, especially hospital emergency rooms, and especially in greater Minnesota, are going to have more and more people come into their doorstep who don't have insurance, and the whole thing's going to unravel. And I mean, if that's what they intend to do, and they've already taken steps to accomplish that, I don't, frankly, there's things that Minnesota could do to reduce the effect of that, but if they're going to destroy it, it's a federally created program, the mandate and the subsidies and everything else. And if the federal government decides they're going to, yank the cord, we're not going to be able to we don't have the resources to offset all that. Now, the reinsurance, has certainly stabilized our market at a high price level, but unlike some other states who are now adopting reinsurance, like Wisconsin, because their rates are going up, but it's leveled off at again, an unaffordable level for a lot of people. And if that gets worse, as you say, if other people leave the market and that pool of people, continues to shrink, all bets are off.
Governor, will the premiums for the people buying into the program be enough to offset the cost of covering more people, or will this program require an increase in either the provider tax or some other public source of funding to make this work?
Up to the $12.9 million of startup costs, the intent is that it be self-sufficient and that the premiums that are charged, are sufficient to have at least a break-even proposition. So it's going to require skilled management. But this was done back sort of before most of my younger staff were born. 1983, workers' compensation was a serious issue in Minnesota for businesses and the insurance companies, and they said it was all because of the state law and driving business out of the state, et cetera. And the legislature and Governor Purvis set up a quasi-public entity which provided workers' comp insurance starting with businesses that could not obtain it or could not afford it in the private market. And lo and behold, it did not drive the private insurers out of the market. Lo and behold, it did reduce some of their prices, but it provided a viable alternative and reduced the overall cost of workers' comp coverage for businesses throughout the state, and it provided a lower cost option for businesses that couldn't afford it in the private market. So, this can be done. It can be administered well, as MinnesotaCare has been for over a quarter century, and is the only thing standing is where the insurance companies don't want competition. And, they've been calling the shots for the last few years. They decide they want to be in, they decide they want to be out. We scramble to try to persuade somebody to stay in, and so we have coverage in every county. And then they dictate the policies, they dictate the terms. And, that's just, it's not working for Minnesota. Maybe it's working for the insurance companies, but it's not working for Minnesotans.
Governor, are you...
I'm going to shift to another topic here. Thank you. Oh, yeah. You're old enough to remember that. Yeah, I am. So I have two commissioners with today who are going to talk about the progress that's been made in the elder care oversight. Starting with Commissioner Malcolm.
Thank you. Good morning. We wanted to take advantage of you being assembled this morning to share some further good news with you on the progress that we're making in cleaning up the backlog in the Office of Health Facility Complaints at the Minnesota Department of Health. As I think the press corps is well aware, we began under Governor Dayton's leadership and direction a very innovative partnership on December 19th between the State Health Department and the Minnesota Department of Human Services. On December 19th, we were facing a backlog of 2,321 complaints that had been submitted to the Office of Health Facility Complaints that were alleging elder abuse or abuse of other vulnerable adults across our state. As of the close of business yesterday, that entire backlog of 2,321 cases has now been assessed. So the assessment backlog has been eliminated. The press may be aware that we have begun posting updates on our health department website, which I think you get every Wednesday afternoon. So even yesterday afternoon, after the posting of that progress update, we have further news to report, and we thought it was worthy of sharing with you this morning. So as I mentioned, all of those, what we refer to as the triage backlog, has now been eliminated. The great majority of those cases were able to be resolved, closed at the level of our internal review. 89, of those 2,321 cases have been referred for on-site investigation, where investigators go to the site of the complaint. So that is the triage backlog, which is now eliminated. In addition to that, we began this project with the Health and Human Services with a further backlog of 826 open investigations, so things that had been through the triage process and found to require on-site investigation. At the beginning of this week, just under half of those open investigations have also been resolved, with the investigations completed and the results of that communicated to all relevant parties. So that there are still 430 open backlogged investigations ongoing. In addition to this, we continue to obviously to get new cases brought in to the system every week, and due to the incredible support and partnership that we've had with DHS, being able to take advantage of their process improvement expertise and their the work that they went through, which I believe Commissioner Johnson may wish to speak to a few years ago. The reason we've been able to make this rapid progress is by taking advantage of the experience learned from our sister agency, who have come and worked shoulder to shoulder with us to not only help us work this backlog down, which is what Minnesotans expect and deserve, but also to design new processes going forward to make this a robust system. And with that, I'd like to publicly thank and ask Commissioner Johnson to speak to a little more of the detail here. Thank you.
Thank you, Commissioner Malcolm. I'm Chuck Johnson. I serve as Acting Commissioner at the Department of Human Services. Wanted to share another piece of progress that we've made in this work helping reduce backlogs at OHFC, and that is that we have, as of this week, in place a paperless process for the intake of all the complaints that come in to OHFC. This is a big accomplishment in the sense that it reduces the dependence on paper, which created some of the problems in terms of backlogs being created and files being confused or misplaced. This new system and workflow handles all the complaints. There's about 400 new complaints each week that come in. So you can understand why having a paperless process is a great piece of progress. Now having no backlog and working forward with a paperless process puts OFHC in a much better position going forward. As Commissioner Malcolm said, this interagency partnership is really working between our agencies, and I want to thank our staff in the Office of Inspector General and our continuous improvement staff for the work that they've been doing with the Department of Health in partnership to address these issues. We had similar issues within our maltreatment investigations about 4 years ago. We learned a lot working with continuous improvement on how to improve that. We were able to bring that experience to the Department of Health to address the issues they're experiencing. And but we still have a lot of work to do. We are not done, as Commissioner Malcolm said. There's still a backlog of investigation cases and more work to do to improve the processes. This is what we need to do to ensure the safety of our parents, our grandparents, and our loved ones across Minnesota. We're also preparing a package of legislative proposals under Governor Dayton's leadership across agencies to bring forward to the legislature to address these issues going forward. And we expect to work with the legislature on solutions this year. Thank you.
As people say government moves too slowly, here in 6 weeks, exceptional progress and results, and I thank leadership as well as their staffs at both the departments for working so efficiently together and working so cooperatively together, and these are really extremely good results. Any questions on this topic?
What are some legislative proposals?
Well, I think it's absolutely critical that we address the operational issues on the complaint end of this whole system, which is what our focus has been. But as the governor has said from the beginning, this issue requires a more robust discussion of what's happened in the care landscape for vulnerable adults in Minnesota, with population growth, with the care needs of people in long-term care facilities becoming ever more complex, and the proliferation of types of care settings, which our regulatory scheme has not kept pace with. The governor commissioned an independent consumer work group, which made a series of recommendations about how to modernize the regulatory landscape and how to better clarify the rights of elders and vulnerable adults in Minnesota and attach some more rigorous enforcement mechanisms to those rights. And the governor has urged, and we will have more to say on this, I believe, in a week or so, that package of recommendations from the consumer work group gets serious consideration this year. Governor?
Other questions on this topic?
Thank you very much. Thank you. All right, any other subjects? Just give me one.
Governor, any new developments on the MinLars, the $10 million that Minute needs today?
There was a meeting last night with legislative leaders and clarify what the situation there's. We've had a lot of meetings with different legislators that don't get communicated to other legislators. So some of the complaints about lack of information are frankly just because of lack of internal communication, but it has definitely stalled progress that needs to be made. The result is today is March 1st, and these layoff notices to both staff and to contractors are going out. And we stressed again the urgency of a legislative response so that we can halt that exodus, and it would be very, very hard once people have moved out and taken other jobs to get a team reassembled. So it's really on the knife's edge. It's really the responsibility of the legislature. They've had fair notice on this this is January. We talked about the need for this $10 million. It's not an appropriation. It's just transferring money from one account within DPS to another. So there's just no reason to hold it back, and the consequences are going to be severe starting today.
Do you have any hope that some kind of authorization to transfer those funds will come today, tomorrow?
I need to follow up with the meeting went into last night with mostly House committee chairs and the Speaker, and I believe one senator, Senator Newman, Senator Gazelka called me last night. He had heard about it, but we'll have to follow up today and see if they're willing to move as quickly as necessary.
Very good. Thank you.
Thank you.